So question is, what makes cord blood such a highly valuable treatment for neurodegenerative diseases, including ischemic stroke? It's because cord blood contains a lot of highly valuable substances on a cellular level and also on protein level. Cellular level including mesenchymal hematopoietic stem cells, especially mesenchymal stem cells, which are able to transdifferentiate to neurons. It contains also mononuclear cells, which secrete a high amount of proteins and as well as so-called exosomes, including microRNA. And these factors, all in all, on cellular and on protein level, are able to taper down the inflammatory process in the brain. They're giving the information of pro-angiogenic growth, a pro-growth factor, and also immunomodulatory effects. And all these effects help to recover the patient's symptoms, recover the neurons, and also to reconnect the neurons with each other. And so far on scientific level, which is known about umbilical cord, is the magic behind umbilical cord. We apply cord blood intravenously because we know it's a very safe method on one hand. On the other hand, we know that all the substances, the valuable substances of cord blood will pass or are able to pass the blood-brain barrier, including stem cells and also the proteins and including also the exosomes. These cells and the proteins as well as the exosomes are attracted by chronic inflammation process which is happening in the chronic phase of a stroke patient. It's a so-called homing effect that due to the chronic inflammation process, the cells and the proteins, the chaperones and the exosomes are attracted and thereby are able to pass the blood-brain barrier, and consequently we are able to choose a very safe application method, intravenous. So let's talk about the treatment itself. The treatment itself will last for about 3 days. First day on arrival, we do a thorough clinical examination. We do blood measurements just to be 120% sure that everything is fine and prepared for the treatment. We have to exclude inflammation and infections up front. We will do a confirmatory typing of the blood group, which is very important, so that everything is set, and we also will address final questions of the patient so that the patient's feeling 100% comfortable with our treatment. So the second day is the treatment day itself. The treatment day contains obviously the transfusion of cord blood. We guarantee a very high amount, a very high quantity of cells so that we want to increase the chance of the recovering of the patient. The process can last up to 4 hours of the transfusion of cord blood. It's monitored, the patient's monitored, we take vitals, doctors are around all the time. Usually the patient's quite relaxed, he can watch TV, read a book or talk to his relatives, so it's a very relaxing procedure in the end. After the transfusion has been finished, we usually keep the patient routinely for another 2 hours in our praxis, taking vitals, look that the toleration is fine, and then he's okay to go back to his hotel usually. On the third day, he will come back. It's the final day. He will come back. We will check again. Routine physical examination, maybe some blood, check kidney function, liver function, some clotting function. But usually that's it then. And the patient on the third day is ready to go back home. The common question is which patients are eligible for our treatment, especially for ischemic stroke. Usually our sentence is the earlier the better regarding the time and onset of stroke. But we also have many patients calling us where the stroke is far away, like 2 years, 3 years. And interestingly, it's been shown on scientific level and also on clinical level that the chronic inflammation process, that's the main pattern mechanism behind stroke on chronic level, which hinders the patient from regeneration, that they are still eligible for our treatment. Estimation, the response rate of ischemic stroke patients toward umbilical cord treatment is about 75%. Cord treatment in the clinical setting is known for more than 25 years now. And all in all, it's been shown as a very safe and tolerable procedure.